Good day, everyone. My name is Wonderful Goodness, and today I'll be showing you a demo through ClerkSmart.
ClerkSmart allows you to clerk patients and practice clinical reasoning outside the hospital.
Now we have a patient generated for us, and I'll go on to talk with this patient like I would in the clinic. I can either use text or I can use voice. Let me show you how texting looks like. So now I can show you how the voice to voice works. You can click the call button. Good day, Mr. John. Please tell me about the fever. Is it present at every time in the day?
Yes, the fever is always there, but it comes and goes. I just don't feel well at all.
Okay, I'm so sorry to hear that. Do you feel like you're cold inside, and do you feel your body shaking every time the fever comes?
Yes, I feel cold and sometimes I shiver a little.
So you can continue this conversation with voice, or you can go back to text. Now let's assume that the student is done clicking this patient. You simply click the finish button and you're taken to a page where you write up your differential diagnosis, you request for physical examination findings, and then you request for your preliminary investigations. So for this patient, these are my differential diagnosis, these are the physical examinations I'll be requesting, and these are my preliminary investigation plan. Now I'll request for results. Right now, we have examination findings and investigation results here. You can scroll to see the vital signs for this patient, as well as read through to find findings on the physical examination. So these are findings on the general examination, and these are findings on respiratory system examination. You can go over to the investigations to see the results of the full blood count and differentials we asked for. And you can read a report or the findings on chest x-ray. Now, assuming in this situation you would like to go straight to the management plan, you click proceed to management. But however, if you want to keep investigating, we can use the other additional investigations where you justify each single additional investigation you're asking. For the purpose of this demo, we'll move straight to the management. So here in the management, you put in your final diagnosis gotten from integrating everything from the patient history, investigation findings, and examination findings, and then you write up a management plan. For the purpose of this demo, my management plan will be to review with seniors how my final diagnosis is community acquired. Now you click the submit for feedback button to get your feedback. Now we've gotten our feedback, and as you can see, the final diagnosis is community acquired pneumonia, and then you read through the feedback to see things you did well, things you didn't do well, how you should improve. We also give feedback on the reasoning journey so that the students can see how they'll perform through reasoning through a case and what cues they should have looked for in this patient. So I'll just scroll briefly through the feedback because the feedback is the crux of this entire product. So as you can see, key learning points for this case, what you did well. And if you open up the clinical reasoning, you see feedback based on the student's approach. So you see feedback on their questioning pattern, you see feedback on their differential reasoning, the possibility assessment of their differential reasoning, as well as their diagnostic journey. So did they anchor on the diagnosis? Did they ask as many questions as required to be able to justify making this diagnosis? And then how to approach this case, show you cues from this patient that should have tilted you towards the correct diagnosis, so that it helps students to learn how to differentiate between differential diagnosis and make an actual diagnosis. So you have feedback on opening complaints, the key history cues, expected examination findings, as well as investigation strategy for this patient. And then we round it up with connecting these pieces so that the student can see how every part of this reasoning flows into making this final diagnosis and properly managing the patient. The clinical opportunities hold places for areas for improvement as well as missed opportunities in this interaction. So my missed opportunities, asking for shortness of breath, asking about pleuritic chest pain, asking about relevant past medical history, obviously because I didn't take a good history here. We end everything off with a caveat which says ClerkSmart supplements but never replaces your in-person patient encounters. Every student is advised to seek every opportunity to learn by the bedside. We build this to provide feedback to every student at every patient interaction that they have, so that we can give them the tools to build frameworks for clinical reasoning that our patients will need from day one. Thank you.